The Founders Day holiday Monday, and we're enjoying it, but we're also going on with our business. Next, we're discussing prostate cancer, but not until I go to Facebook and not until I wish a very special person a happy birthday. It's your birthday today, Mrs. Abigail Ante. Happy birthday to you. We hope that you enjoy the day. Obviously, it's from your husband, Emmanuel, and all of us, his colleagues. We're wishing you the best of the day. Let me go to Facebook. We put there, good morning and happy Founders Day. But not everybody is happy about the good morning and the Founders Day. Some people describing this holiday as very useless. I'll share the thoughts with you. So here are messages on Facebook, and Boham Patrick is saying that Ghana is the laziest country ever I have seen. A country with so many holidays. Yes, when it hits on weekends, they push it to weekdays, affecting production and sales. Yet we want to be a developed nation. That's your thoughts, Boham. Yusufo Konadi simply says, fix the economy and stop this useless holiday. He decides to put it. Philip Ajekum from Poman. So what is this holiday talking about? What is it about? Well, we're celebrating our founder, Dr. Kwame Nkrumah. It was his birthday yesterday, his 105th, and that's why it's a holiday today. Charles Ajuman, very unnecessary holiday by all standard. And you add a few other things that I cannot read out loud. Idris Musa says, we're not serious as a country. Oh, Ghana. Why? Because today is a holiday? Well, Jerry Opon Educhum says, hear them praising old Nkrumah, hear them exalting his name. Oh yeah, he was great, but all these times, that's what we have been doing. If he was here right now, he would be in jail. Okay, I don't know on what basis that you're saying that, but keep the messages coming through on facebook.com/Joy News on TV. Next, of course, every Monday in the month of September, we're discussing cancer. We're creating a lot more awareness on cancer. And today, we're discussing prostate cancer. Of course, last Monday, we did discuss breast cancer. So my doctor is in again. Dr. Clement E. Edusa is radiation oncologist. It's a specialized units in the medical field. And he joins us again. Good morning, thank you.
Good morning, Mama.
Yeah, maybe I should just get your thoughts on the holiday.
Personally, I think it's good. I mean, I'm a fan of Kwame Nkrumah. We all know that there are positive and negative sides of every individual.
Sure.
But he's got a long-lasting legacy, which we see up till today. So I think it's a good thing.
Okay, so it's a good thing that today is a holiday.
I think it's good.
All right.
It makes us rest.
All right, so let's talk about prostates. I've read, I think, a few articles that's saying that we are the highest prevalence rate in terms of prostate cancer, but we don't have figures that can confirm this, do we?
Yes, unfortunately, we don't have cancer registry, a holistic cancer registry, which captures all the cancers in our country. So it's really difficult to give an exact number of people who go through that. But then worldwide, and even in Ghana, from our experience, we see that prostate is the leading cancer in men. Yeah.
Okay. How can one get it? Is it something that you can get from touching or hugging or having sexual relations with someone?
Not at all. One gets it, by being a man, so you're already predisposed to that. By being 50 years and over.
Okay.
By having lots of alcohol and smoking and eating lots of fat saturated, it goes back to the diet.
Okay.
Processed meat, red meat, and then fat.
So we're talking on healthy living.
Still healthy living.
Oh, okay.
Anywhere you go.
Okay.
Yeah.
Wow. Okay, so you're talking 50 and above.
50 and above. If you have a family history, or if you are of the African descent, we tend to look a little bit earlier. If family history, you start screening from about 40, and then if you're of African descent, 45, because we tend to be high risk, and studies have shown that we are high risk, so it's early. It's better to screen earlier.
Okay.
Yeah.
Okay. So let's stay with the screening process then. How often should you be screening? year?
Usually it's once a year, and usually what is done is you do a digital rectal examination, not a nice experience.
Digital rectal examination.
So you actually push a finger into one's bum.
Oh.
Right, and then the easiest way is to do a blood sample, and that is the PSA, that's the prostate-specific antigen. And if it's elevated, then you do further series of examinations and tests.
Okay.
Yeah.
So how early should you be testing?
For us, I would say from 45 years of age.
Okay.
Yeah.
But do you have special cases where people below 50 are getting it?
Yes, you have. But usually it comes with symptoms. So prostate cancer comes with symptoms, so I'm sure we'll go into that.
Yeah,
later.
perhaps we
or
could
we
just
could
jump
start
straight
right
into
now.
it.
Yes. So symptoms of prostate cancer is lower urinary tract symptoms, which could be hesitancy. You want to go to the loo and then pass urine, and then a few seconds before it kicks. It doesn't pass immediately. You notice that sometimes your stream is not as strong as it used to be, so you are aiming there.
Your
and
stream, which one is your
the
stream?
urine stream.
Okay.
So you are aiming there, and actually you are hitting there. So there's weakness in the stream.
Okay.
Right, and then sometimes it's associated also with the, bladder infection or urine infection.
Okay.
And then nocturia, so you pass lots of urine at night. But of course you need to differentiate between diabetes and then the prostate cancer. Or a benign prostate hypertrophy. So it might not be cancer, but it might be an enlarged prostate, which is also leading to those symptoms.
Okay. Okay. So when you realize that you have any of these symptoms that you talk about, what should you do?
You need to see your doctor, preferably a urologist. They specialize in urinary tract symptoms.
But we know that we have just a few in the country again.
Yeah, as I said earlier, we are understaffed. I mean, medical teams in Ghana, we are so few on the ground. But all the same, if you don't mind standing in the queues, or if you want to go private, by all means, you get a doctor who sees you.
Okay.
And such doctors would run series of tests, ultrasounds, your same PSA screening, which might show something. Yeah.
You know, sometimes people are not, people will not go to the hospital because they might feel that because of the tests, the different tests that you go through, it will be expensive.
Yes.
With your experience, is it very expensive?
I think there is some amount of cost added to that. But then with, if you're talking about public, and then if you are under national health insurance, some of that cost is taken off.
It's covered, okay.
And people must not forget that leaving things for the end actually becomes double or triple the price. If you catch it in the nip earlier on, it's much cheaper than treating the whole disease.
So what's the treatment process? How long does it take? Is this something that you can be healed of completely, or it's a situation that is managed?
For cancer, it's a situation which is managed. We like to look at cancer as a chronic disease. So if you have diabetes, hypertension, it's a chronic disease. You can live with it. There are medications for that. We like to think of cancer that way.
Okay.
Years ago, cancer was seen as a terminal disease. If you have cancer, you are dying. These days, we don't like to think of it that way. And secondly, if you get it very early, you can be cured of it completely. So if it's early stage disease, you can go through the process. You can have either surgery, prostatectomy, prostate can be taken out, or you can have other modalities, which is radiotherapy, which is brachytherapy, which is cryotherapy. So there are so many of them out there, which can lead to cure, and then you'll be cancer free.
And all these treatments can be done in Ghana?
Most of them can be done in Ghana. So radiotherapy, surgery, and brachytherapy can be done in Ghana.
Okay.
Which is the majority of it, yeah.
But can one protect himself from getting prostate cancer?
Well, it's protection, yes, you can. Healthy life. So you eat well, you avoid red meat. It doesn't mean you shouldn't take it. Reduce it, reduce fatty foods, take in lots of fruits and vegetables, selenium, tomatoes which contain lycopene, have a protective role for the prostate. Beta carotenes, which is carrots and then broccolis and all those things, also give a protective distance. So it's essentially healthy lifestyles, and of course take out the smoking and drinking, excessive drinking.
Okay.
A little bit is okay.
Okay. So all these things comes back to lifestyle, how you
Exactly.
carry yourself and how you keep yourself.
Exactly.
Are men in Ghana generally aware of prostate cancer?
I think the awareness has improved within the past 10 years. I would say that people were less aware in the past 10 years than they are now. Because 10 years ago when I was working in the government sector, we used to see more late stages, people who come paralyzed, people who come with broken bones because of prostate cancer. Now they are coming much more earlier.
Okay. So now that you mentioned the broken bones and paralyzed, let's talk about what it can do to you when not treated.
When not treated. So just from the beginning, if you have prostate cancer and then you don't go to the hospital and you are not diagnosed, it tends to grow. And it grows by blocking your urinary passage, and then it leads to those symptoms which we earlier mentioned: dribbling, hesitancy, nocturia. And after some time, it grows out of the prostate into the surrounding organs. So you can have rectal bleeding or bladder bleeding, passing urine through your rectum or your bladder. And the late stage is metastasis. Metastasis is spread of disease. So prostate cancer cells enter the bloodstream and go and lodge in the bones, and they eat away at the bones. So then you tend to experience low back pain, and everybody says, oh, or if you go to the traditional healers, they'll say, oh, it's old age related, let's give a little bit of massage and break it further down. And then you end up with paralysis, in a wheelchair, not able to walk anymore.
Wow.
Yeah, it's terrible.
How often do you see such cases, you know, like extreme situations?
Pretty on a daily routine. You tend to see people coming in such stage on a daily routine. And I would say about 30 to 40% actually had no initial symptoms. So no urinary symptoms.
It just happens.
It just happens. So you have low back pain, and then you relate it to your age, and then one day you just can't walk.
Does it mean that every little thing that you feel in your body, you have to go to the hospital?
If it persists, yes.
But if you were to go to the hospital with, you know, lower back pain, depending on which hospital you go to, they'll just ask you a few questions and your age, and then they'll say, oh, you know, it's associated with growing up. We'll just give you some ointments and, you know, get your wife to massage the place for you.
But that's what I say, it's the education. So if the doctors are well educated and have that info, because, you know, in oncology, we think everything oncology. So if you have the least symptoms, oh, can it be a cancer? A doctor who treats hypertension thinks hypertensive-wise. A person who treats diabetes thinks diabetes. So we have that thought process. So a doctor who is in the district who doesn't have the oncology basis would take
and
it
that's a specialized area. So if I'm a general practitioner, then I may not know some of these technical things.
That's why you have to watch Joy News.
Right? Okay, but you work at the Sweden Medical
Medical Center. That's right, Sweden Ghana Medical Center.
Yeah. Is it a place that you can just walk in and say, for instance, like, can you just go to the lab instead of going to the hospital directly and say you want to do an examination?
Yes, we have GP services, so it's also a walk-in clinic. So if you have those fears, you're always welcome. You walk in, we take your lab tests, we do an examination, physical exam, and then we take it on from there.
Okay. So generally, what's your advice? Because personally, before, when I feel something, I would go to the lab first and go and do a lab test. So I'll say do a full blood counts before I go and see a doctor for interpretation and then whatever.
Yeah, but you
is that good?
It's not good, because you might not know which lab tests to do first of all. Secondly,
you can decide to do, you know, the full blood count and say do malaria, do typhoid or something.
Yeah, but I mean, the doctor can save you money, you understand? He can sort of narrow it down and say just do these 2 tests, whilst you'll be doing maybe 6 or 10 tests. So at the end of the day, you would be wasting money. It's a good thing to do a general medical test at least once a year, full, comprehensive. It keeps track, and then the doctor is able to see what goes wrong with time. But if you are sick And if it's just pain, it's allowable to take a few painkillers, 2 or 3 days. If that pain persists, you need to see the doctor. Or if any other symptom persists, it's good to see a doctor. Yeah.
Okay. All right. So we're talking prostate cancer in our cancer series every Monday in the month of September. And my guest is Dr. Clement Edusa, radiation oncologist. He works with the Sweden Ghana Medical Center Limited. And I've got to ask you again, what the medical center does?
We treat all cancer cases, and then we treat also benign cases like keloids. Keloids are growth of scars which need excision, and then they tend to grow back again. So by giving radiation, you can stop that regrowth of those benign cases.
Okay, so generally that's what the center is specialized in.
Yes.
Okay, and it's a place where anybody at all can walk in?
It's a place where anybody can walk in. It's a private institution, so there is some cost attached to that. Luckily, we have corporate bodies which we offer free treatment in a sense that when they come, they don't pay. They pay 1 or 2 cedis into their contributions wherever they come from, and then they are able to access free treatment. So NAGRAD, NAT have those opportunities. We are in talks with the Nursing Association, mining, and some media houses as well.
Okay. Okay. So apart from that, if you are like myself, you just have to walk in and
Yes.
then. Okay. So where are you located?
We are located at Adringano. It's beyond School Junction, East Legon. Yeah, it's very easy to find us if you are on the internet. You just Google Sweden Ghana Medical Center, and then there's a map which pinpoints our location.
Okay. All right. I have something else that I want to ask. What families can do to encourage their fathers, their husbands, to go and take the test for the prostate cancer. But I just want to announce, perhaps we can pick, about 3 phone calls. So you can give us a quick call now, 0302-211-6910, 0302-211-6910. 102. You can give us a call on this prostate cancer. I appreciate it if a lot more men would call this morning, because this is about you. Yeah. But back to, how do I encourage my husband or my brother or my father to go and have this test done?
Yeah, what we've realized is people are really reluctant to go to hospitals when they are not ill. But that habit should change. And I think the change starts from us. I'm sure if you talk with your dad or your husband, you would agree that it's much more nice to live in a healthy environment,
yeah,
and with healthy conditions.
Sometimes they'll say that perhaps I have something that I don't know of, and if I don't know and I'm still living, it's better than going and then finding something that will make me think,
I agree, but there are always 2 sides to the story. We always say that if you find it earlier, it's easier to treat, and then you have a higher chance of getting cured than coming with it late. If you're coming with it late, then you actually have very little time remaining, because metastatic cancer is very difficult to treat, and most people, I would say maybe everyone, would tend to die from metastatic cancer.
Wow.
Yeah.
Let me speak to Frank now. He's joining us from the Ashanti region. Good morning, Frank.
Morning.
Yeah.
How you all doing?
Yeah, we're good, by God's grace, and we're enjoying the holiday. We hope you are too.
We too. We are also enjoying the holidays here.
Good. Let's hear your question.
I'm calling from, my name is Frank, calling from Ashanti region, besides Kumasi.
Okay.
Well, my problem is we find it more hardly to even consult the doctor nowadays. Because whenever you go there, the queue at the government hospital, but if you don't take care, you come back to your home. But my problem is, right now, I'm having some little problem. I don't know where the prostate cancer starts. I don't know the ages that it starts from maybe 30 to 45 or 40 to 45.
He's mentioned 50. He's mentioned 50, but there are always special cases.
There are always special cases. Okay. And I heard from the doctor that some people have male alternative like the nut, the nagrat.
Yes.
Whenever you are ready to come, it's free for them. So I want to know where we can relocate them.
Okay. All right, Frank. Thank you very much. Okay. So he'll give the location again, even though we've talked about it.
But I think with NAT and NAGRAD members, what they need to go is to go to their regional offices.
Okay.
And then the offices contact us. Because
Do you have centers in the other regions?
we don't.
Okay.
Our center is only in Accra. But their offices coordinate all this flow of patients to us. So,
Okay.
yeah,
Okay. So if you're a teacher, because you had NAGRAT or NATS and you're a member, you go through your regional offices and then you can get the details as to what you have to do. But if you've got any question that you want to ask, please do so. You can call 0302-211-69102. And then your question would be answered because I have a special doctor here with me today talking prostate cancer. Okay, so any other thing that you want to share with us? You didn't mention exercise, or that is not relevant?
It is relevant. I didn't mention because we were going through the flow of preventing. But exercise is definitely very relevant because exercise burns down your calories. It burns down all the fat which is in your body and is necessary for staying healthy.
Okay.
Diet and exercise. Yeah.
All right. Let me speak to Dan now. Good morning, Dan.
Good morning, madam. How are you this morning?
I am very well. Thank you, Dan. Thank you for asking. Let's hear you.
Okay. I'm listening to the doctor. And then I have a problem and I've been going to hospital for almost a year now. I urinate a lot. I've done the PSA talk about according to the doctor, according to the urologist, my prostate is very small. And I've been on antibiotics for almost a year. The problem is still there. I feel comfortable at my lower side. As I'm speaking now, even my waist is paining, and then the distance, my right side, deep down the bone, I don't know how medically they call it, but I decide at the socket from where my back, where the joints, the two joints meet. I feel a lot of feeling, and I'm taking a lot of medicine.
Okay.
The problem is
Okay. So Dan, where are you? Are you in Accra?
Tamale.
In Tamale. Okay. Are you done with the question, or there's something else? Because I wanted the doctor to address your concerns.
Okay, I'm done with the question.
Okay, all right. So Dan is done. Thank you very much for calling. But just stay on, Dr. Dusa.
Yeah, thank you, Dan. From listening to what you just said, you mentioned that PSAs has been done for you. You didn't mention the value, whether it was high or low. If it is low, no one would follow up the cancer trail for you. If it is high, then it's highly suspicious that it's cancer, and then they'll do some other workups. About pain, I don't know your age, but usually with age, we tend to have arthritis. So you can have pain in joints, and that pain can be really excruciating. I would say one thing. Check on the PSA, ask your doctor if it is high or low. If it is low, then it's not cancerous. If it is high, they need to do further investigations. If it is high, they need to do a biopsy. So you need to do a needle biopsy of the prostate to see if it is cancerous. Prostate cancer can be even in a prostate which is small. So that they need to know. And if it is cancerous, then you need to follow up with a treatment and sometimes even do a bone scan. Unfortunately, bone scans are done only in Kolebu in Accra, so you need to come down all the way to Accra for
Wow.
that. Yeah.
Okay. And is there a queue?
Is there a queue?
Yeah.
There's a booking system, I know about
Okay.
that. So you can call and then they give you a specific day so that you don't queue.
Okay. I think that will be good because you are in Tamale. But let me speak to Steve now. Steve is joining us from Accra. Hello, Steve.
Yes.
Good
Yeah,
morning.
Good morning.
Yes, sir.
Is the program open to just NAGRAS members?
No, no. This is special. This is actually not very topical. What he's trying to explain is that the center has special arrangements with some corporate entities, and NAGRAT and NAT. So yeah, but on your own you can't go there.
Yeah.
Okay, where exactly are they located, please?
Okay, so is that all? Is that all you want to ask?
Yes, or if
Okay.
I can even get the doctor's number.
No problem. Thank you very much. We'll let you know, but he'll give. Yeah, sure. Thank you very much. Is there is there a certain number that you want to
There are
give about
numbers
this?
of the center.
The
there,
center,
yes, on
okay.
the card, so, yeah.
Okay, so I'll give these numbers when we are done with the discussion,
Right,
so
okay.
that I don't have to go over and
Exactly,
over and
yeah.
over
Okay,
again.
yeah.
Okay, but this PSA test that Dan mentioned and then you also mentioned,
Yes.
can you go over it again for us?
The PSA test is a blood test which usually is taken from the individual who is 45 years and over, and it ranges from 0 to over thousands. Now, from 0 to 4 is then as the normal PSA, and it tends to rise slightly higher as you are going through your age. So 50 to 60 is slightly higher than 40 to 50.
Okay.
So when you do a PSA test and then it lies within the range of 0 to 4, we think it's a benign process, it's not malignant. But if it goes 10, 15, 20
Okay.
and upwards, then there's a high suspicion for cancer.
Cancer, okay.
And then the doctor would say, you know, your PSA is high, you need to do a biopsy.
Okay.
Let's do a biopsy, let's get some tissue, let's take it to the lab and see if it's really cancer.
Okay.
Yeah.
All right. So that was the advice to Dan.
Exactly.
Check if it's high or low,
it's high
and then
or
you
low,
know
and
where
then
to
you
take it.
follow up on that.
All right. Let me speak to Shaibu now. He's joining us from Tamale. Hello. Good morning, sir.
Good morning, madam. How are you?
I'm very well, thank you. Thanks for asking. I hope you're well too.
Oh, yes, madam.
We thank God. Let's hear you.
Honestly, in fact, I just tuned in and I didn't see the start of the program. But I just want to ask a simple question. What are the symptoms of the prostate cancer?
Okay. All right. Thank you very much.
Okay.
We said that, but since you're joining,
We
I
can do
get
it quickly,
you.
yes. Symptoms are lower urinary tract, symptoms which is hesitancy, you only go to urinate and then it takes some seconds before your urine flows, weakness in the stream, you're urinating and you're seeing that your stream is not as powerful as it is, dribbling, sometimes you want to have a stream and it's actually dropping, and sometimes your urine doesn't flow, so we call it total anuria, and sometimes patients are rushed to the hospital to have a tube inserted for that urine to come out. You can also have blood in the urine, which can be a sign and symptom of it, and sometimes people complain of pain within the area of the bladder or within the pelvis.
Okay. Let's speak to Joe now. He's joining us from Takrady. Hello, Joe.
Good morning.
Good morning, Joe. Thank you.
Yeah, I'm 48. Yeah, I'm 48. Uh-huh. I did the PSA and I'm told it's low. So I don't have prostate cancer. But I used to have the urgency to urinate. That's why I did the PSA in the first place.
Okay.
Uh-huh. But now I noticed that that's dribbling. Anytime I urinate.
Okay. So you want to find out why?
Yeah.
Okay.
Yeah.
All right. We get you. Thank you very much. But okay.
Okay, so Joe, earlier on we mentioned that you can either have prostate cancer or a benign prostate hypertrophy. So if your prostate is larger, you can have the same symptoms as you're having in prostate cancer: dribbling, urgency. So what you need
What
to
is
do...
dribbling?
Dribbling is drops of urine.
Okay.
Instead, you want to have a stream, or it should be a stream,
Okay.
and it's actually drops.
Oh, so that's the same as you said. You are aiming at somewhere, but
That's
it's
right.
also
but it's,
okay.
it becomes weaker till it dribbles.
Okay.
And then you have, you pass urine, you think you're done, and then when you're moving, then you see that there's still residual urine.
Okay.
You try and push, and then it's now only drops coming out.
Okay.
Yes.
Sure.
So in your case, most likely you have benign prostate hypertrophy. You need to do an ultrasound. You need to have a digital examination of your prostate, and the doctor will tell you whether your prostate is small or large. If it is large, then it's benign prostate hypertrophy, and then they have specific drugs and medications to shrink it, to make it smaller, and then to improve your urine flow. Sometimes even with urinary tract infections, you can have the same symptoms that you're talking about. So
I've got a question on the urinary tract infection, but let me speak to somebody joining us from Tamale now. Ibrahim. Yes, Ibrahim. Thank you for calling.
I want to ask the doctor whether...
Ibrahim, you've got to speak up a bit for me. You're really low.
Please,
whether
my name is
it can be gotten out of too much sex.
Too much sex, you mean?
Yes, please.
Okay. What is too much sex?
I'm only asking because one time...
No. Because what is too much for you may not be too much for me. That's why so it's just a question. I just want you to explain.
And sometimes some people might have it in a week more than 4 times.
Okay.
I don't know.
Okay.
And I want to ask if somebody has ever got from the family and
okay, sure. Your line was not exactly clear, but we get your question. Do I have somebody else joining us from Teshiman on the line? Hello? Okay, we lost you there, but let's deal with this. Can you get it out of sex? He explains too much sex to mean you're having it 4 times a day or 5 times or something of the sort.
Yeah, if it doesn't make you tired. Essentially, I don't think so. You can get sexually transmitted infections, not from too much sex, but from just having sex. And sexually transmitted infections can give you urinary tract symptoms. There have been controversies or studies which shows that a lot of sex is protective, and other groups says that it's the other way around.
Yeah.
Lots of sex can
Some
be
say
actually...
it's another form of exercise, so it's actually good if you're okay.
It is if you're okay, but you know, some link the excess sex or too much sex with your level of testosterone, and that is your male hormone.
Okay.
And it's the testosterone which actually feeds the prostate cancer. So the more you have, the worse
the more
it's for
you're feeding it.
The more you're feeding
so
it.
the more you're growing it, if you like.
Exactly.
Okay.
Yeah. So I mean, but it's nothing that we can control. And the sex bit, I haven't seen anybody saying that. Yes.
So there's
lots
no
of
scientific
sex. There's no scientific.
Sure.
Contact.
Let's speak to Yao. He's joining us from Ho. Perhaps you'll be the very last person that we'll be speaking to on the phone. Hello, Yao.
Hello.
Yes, Yao. Let's hear you.
Yeah, I'm not Yao. I'm John, calling from Soko in the Thai district.
Oh, okay. Apologies there. Let's hear you.
Okay. What I want to know is, since somebody mentioned sex, I want to know if really masturbation can bring about prostate cancer.
Okay. That's all?
Yeah, that's all.
Okay. Thank you for calling.
No,
You're shaking your head already.
Yeah, well, I mean, I don't think
it's
so.
a no.
It's a no. As I've said, there's no scientific data for that, and masturbation is another form of sexual self-gratification, I would say.
Yeah, which is not encouraged, really.
Which is not encouraged, yes, but I would go a step further that it's not the one which causes spinal compression and stuff. There are people who say that if you do that, you end up paralyzed and blah blah blah.
No scientific
at all.
Okay.
Medical.
All right. The issue with the urinary tract infection, could it lead to prostate cancer in a way?
Not really. I don't think urinary tract infection would be leading to that. I mean, it's more of a genetic fault within the prostate cell or cancer cell in itself. And urinary tract infection is bacterial infestation of either your bladder or your kidneys or any of the pathways for your urine.
Oh, okay. All right. Okay, then, you want to summarize everything for us before we go?
Well, yes. We can put it in a small nutshells that prostate cancer is disease affecting men who are 45 to 50 and above. Symptoms, as we've mentioned before. And I would stress on the fact that we must go to see the doctor. Don't stay home. Don't see anyone else. It must be the doctor who pinpoints it and then gives you the direction to cure.
Okay.
That would be
You know, the gentleman who called from Takrady about the fact that he's done the test. Let me remember.
Yeah.
He did the test. It was low.
Yes.
It wasn't high. So
Yes.
he doesn't have prostate cancer.
Yes.
However, he's
having the symptoms.
yeah.
That's right.
In terms of the urinal,
Exactly,
or, which
yes.
is
Dribbling and hesitancy
exactly.
and-
The series of tests you're asking him to do, is this something he can do in Takrady, or he has to come to Accra
No,
to
you
do?
can do that in Takrady. Yes,
Okay.
you can do that in Takrady.
Okay.
Any general practitioner or any urologist can request ultrasound for you so that they can have a look at the size of the prostate. They can do a digital examination to see if the prostate is large or big.
Okay.
And then they can administer medications which tend to shrink your prostate
Okay.
and help you.
With those who are calling from outside Accra, do you come directly to Accra to the hospital, or you need some sort of referral? Which one is quicker?
Usually it's referral, because if you don't have a referral, you have to go through the slow process of going through polyclinics who refer you to the tertiary institutions.
Okay.
So having a referral is a plus.
Okay. All right. So I want to say thank you, but I want you to give the location again, because that was something that was coming up, and then I'll give the phone numbers.
Yeah, we are located at East Legon at Dringano on Mahjong, and it's a little bit beyond School Junction. You can locate us easier on your Google Maps. I mean, you just type in
And then it will take you
Sweden.
right there.
It shows the point right there, and
Okay.
then it's really easy to navigate.
Okay. All right. So I'm giving you the numbers to Sweden Ghana Medical Center Limited. That's where our doctor is coming from. So these are the phone numbers: +233 307 032 133 and +233 307 032 134 +233 307 032 134. You can give them a call and then book, and they will take care of you. But for this morning, I want to say thank you to you, Dr. Clemente Dusa, for
Thank
your
you
time.
too, Mama.
Thank you. We're doing this series with you, so we'll see you again, God
Definitely,
willing.
yeah.